TQ, looks like we have 5 participants so far, up to 7.
Okay. You just let me know when, and I'll just get started, okay? When we get everybody in the room.
Will do. Welcome to everybody who's joining. We're just letting everybody sign in, and then we'll get started.
Hey, good morning, everybody.
You got to just make sure that you mute your mics, please.
They're already pre-muted for the webinar, TQ, so we're all set. You don't have to do that. Q.
Maybe she was talking to me, so.
Oh, maybe she's, we'll see. Let's see. Welcome everyone who's just joining. We're just waiting for everyone to be able to sign in, and then we'll get started. Seeing lots of friends sign in, new folks who we haven't met yet. Welcome. We'll just give folks maybe one more minute to sign in, and then we'll get started. Okay, so our participant list has slowed down for sign-ins a little bit, TQ, so I think you are ready to get started whenever you're ready.
Awesome. Thank you, Marissa. So good morning, everybody. We are so excited to be here to discuss an important topic. First, we want to say thank you all for joining our webinar, which is called Food is Medicine, Getting the Food to the People. So this is going to be our first series of 3 that we have planned over the next few months. So again, welcome. And my name is Dr. Taquina Davis, and I'm currently the Senior Advisor for McLane Health Solutions. And so today we have Denton McLane, who is the Chairman of McLane Global Logistics, and Marissa Parisi, who is the Director of Health and Hunger Solutions, which is a sector of McLane Global Logistics. So good morning, Denton, and good morning, Marissa.
Thank you, TQ.
Good morning, TQ. Thank you.
So I am so excited to be having this conversation with you both, because I know McLane Health Solutions understands the importance of food being medicine and the role it plays when it pertains to the health of the community. I think it is amazing that McLane Global Logistics has invested in developing strategies to help offer medically tailored meals to various organizations. And I'm going to pause and ask that our panelists introduce themselves. And so Marissa, I'm going to start with you. So if you can introduce yourself to everyone.
Hi, everyone. I am Marissa Parisi. I am the Director of McLane Health and Hunger Solutions. I've been with McLane Global for the last year, and I have a background in both healthcare and hunger relief. And it's nice to be here. Thank you, everyone, for joining.
Thank you, Marissa. And Denton?
Hey, good morning, everybody. My name is Denton McLane. I'm the chairman of McLane Global. I have been in the food business since I started working our family business when I was 8 years old. So have been in the food business almost 40 years now. I'm an old man, but enjoy getting to work and create new opportunities with food around the world, and most especially here inside the United States.
Awesome. Thank you, Denton. Thank you, Marissa. And thank you both for the great work that you're doing. And I'm excited to hear about your experience and passion and the work that revolves around food as medicine. And I do believe that this conversation is fitting, considering the White House hosted its first hunger and nutrition and health conference in 50 years. And I had the opportunity to tune in and hear some of the great speakers that talked about health equity, chronic disease prevention, system changes, and policy changes that need to happen. And recently, also, the White House released its strategy for ending hunger and increasing healthy eating by 2030. And I think we all know the importance of food and the role it plays in our health And there's so much research out there. And according to various studies published, participating in medically tailored meal delivery systems programs was associated with fewer inpatient admissions and lowered healthcare costs, which demonstrated the potential for these programs to improve health outcomes for vulnerable patients with complex medical conditions. So the vulnerable individuals who stand to gain the most from medically tailored meals are those with one or more complex chronic disease, those that are socially economic disadvantage, and who typically face food insecurity. And I know that McLane Health Solutions Food is Medicine focuses on alleviating the stress and the anxiety involved in accessing food, healthy foods, so chronically ill members can focus on healing. And many credible organizations focus on specific diets and food intake. For example, the American Diabetes Association and American Heart Association are always recommending consuming certain types of food that have great health benefits. Prime example, I know Marissa and I, we've been going back and forth pertaining to the boxes that we created, is the DASH diet, which is the dietary approach to stop hypertension, and also the Mediterranean diet. So for many chronic disease, chronic disease is actually preventable. So poor nutrition and food insecurity can lead to health problems that frequent use of expensive medical services. And medically tailored meals programs offer a possible solution to these issues. And McLane Health Solutions provides home delivered pantry style meal kits to individuals and families living with critical and chronic illnesses. And these meals are medically tailored, meaning that they're customized to meet the nutritional and medical needs of their clients who are fighting chronic diseases like hypertension, diabetes, and heart disease. So now let's get into a roundtable discussion on the work that the role McLane is playing when it comes to the important topic. So I just gave just a brief synopsis of the importance of the work that you guys are doing so that people can get an understanding of that there's conversations that's revolving around food as medicine. And you guys have taken a very proactive approach to making sure that you can be at the table to have these conversations and want to be part of the conversation. And I know previously you mentioned that this was a family organization. So can you tell us about the McLane family and how they got into the food business?
Absolutely. Thank you, TQ, for that introduction, and just really appreciate being here today. McLane family, I'm now generation number 4 in the food business. Long story short, is the family was originally from South Carolina when we came over from Scotland way back in the day. And then after the Civil War, that wasn't the place to be. And great-grandfather McLane walked to Texas to restart his life and look for new opportunity. He got there and he worked on a farm for a couple of years. And then in 1892, he started a small business called McLane Company, founded on 3 simple principles: honesty, integrity, and Christian principles, what we still follow to this day. But really got that started, got the business started, handed it off to my grandfather, who without a college education managed through 2 wars and a depression. Grew the business into a regional business, but then what they really did was buy from big brands and sell to local groceries in the local community, starting on horse and buggy and then eventually getting up onto trucks. And then my dad came into the business in the very late 1960s and then started growing the business tremendously based upon the growth of the convenience store business, which was a new business model for that era. Wholesalers weren't used to selling to businesses, frankly, that they were that small of a square footage and had that little goods in it compared to what a grocery store had back in that time. And so then Dad grew the business tremendously on that, along with those businesses, but then found Walmart in the very early 1970s. And he said, once you saw them, you knew they were the future. And then worked alongside the growth of them, grew alongside both of those industries, built out a nationwide industry that still operates to this day. We ultimately sold the business to Walmart when Walmart transformed into the supercenter concept, wanted to get into the grocery business. And at that time, Walmart in the industry is known more as a logistics business than a retail business. business sometimes, and that the board wouldn't even let Sam Walton open the first super center until he could prove that the Walmart could manage the logistics for all of the products that went inside of it. And to do that, they needed to buy McLane Company because we could do fresh, frozen, perishable, all of that type of complicated food logistics. Then Walmart owned it for about 10 years and then sold it to Berkshire Hathaway, who still operates it. You'll still see McLane trucks running up and down the road doing their thing. But then the family started investing in small food and logistics businesses. This business, McLane Global, was one of those. It started its life in the 50s as called MC International. It exported food business or food around the world, and then the family purchased it to see what we could add to it with our logistics knowledge.
Awesome. Thank you, Denton. That was a very impressive story and about how the organization developed with the family. So I do have a follow-up question for you. So why does McLane feel like it's important to be involved in the healthcare sector?
Well, McLane Global is a multifaceted business. It operates in a lot of different industries. What we do is based really on two different dimensions. We are sourcers of food, so anything that's intellectually inside of a modern grocery store, we go directly to the manufacturer sourcing food. So it can be fresh, it can be frozen, it can be perishable, it can be health and beauty, it can be vitamins, it can be anything you find in a grocery store. And then we want to be able to have cover the world whenever we source it. So it's not just American product or Chinese product. It's really, we can go and find a custom solution for what our partners are looking for to solve their unique needs. And then the second dimension we work on is logistics. Once we found the food, we want to be able to move it as efficiently as possible and get it to the customer when and where and how they want it. We primarily work with retail chains internationally and domestically. We work with convenience stores. We work with e-commerce platforms. But then in the financial collapse time in 06 and 07, started seeing a new unique customer come to us, which was, we're primarily based in Houston, Texas. And it was the Dallas, Houston, and Austin food banks. And they were looking to buy some product that we were discounting and trying to get rid of. And we were said, well, we'll sell it to you, but why are you looking for food? And that's when we just started getting a huge education on what hunger relief looked like inside the United States and what pressure was getting put on the food system to really be able to meet people's nutritional needs in a cost-effective manner. And we saw that, hey, with this network and these platforms we work on, we can help solve problems for those guys as well. And then we said, this is so important, we can start a whole new division, and we called it McLane Hunger Solutions. And that we now started over 15 years, started working inside the hunger relief segment, working with food banks nationwide, helping them source bulk commodity product, but then also helping them build individual unique programs for backpacks or senior care or whatever unique initiatives they're trying to focus on. And then through that, we really saw, there's another angle to the same problem, and we're experiencing it in the healthcare sector, where especially for lower income individuals, Medicare and Medicare Advantage customers for health insurance companies and hospital chains, they still are having all of the same healthcare problems that we all face, but they're having lack of access to be able to find high quality products that speak directly to their program, their location, and their ethnicity. And we saw, hey, this is something that we can similarly do in healthcare, for healthcare, like what we've done in multiple other segments. And that's what we really have started trying to be seen through McLane Health Solutions is, hey, what are the unique outcomes that are coming online in the healthcare segment, and what can we do to help solve some of those problems?
Awesome. Thank you, Denton. And I know Marissa didn't mention the hunger solution side, and I know McLane Global hired you to oversee this sector, but also, they've additionally asked you to oversee the healthcare sector, the health solutions sector. Can you tell us about the hunger solution sector and why you feel that the investment in the health solution sector is so important?
Absolutely. Thanks, TQ. And if you don't mind me making just a quick logistical announcement, we have the Q&A section of the webinar open if folks have questions for us, and we'll make sure that we try to address any questions. We do have one question in there, and hopefully, TQ, we can find some time to circle back on those. I have, as I mentioned in my intro, I have worked in hunger relief for over 15 years. I ran an anti-hunger organization where I live here in the Northeast for 9 years, really focusing on access. And the interesting thing about hunger in our country is that I learned this term yesterday at the White House Conference on Hunger, which is, I think, absolutely true. And that is the monotony of the American diet, which is many people in our country who experience hunger experience it in the way that they have access to lower quality food, inexpensive food, not a full range of fresh food or pantry items that can actually improve their diet. And when I was working in hunger relief for a very long time, we would hear from the healthcare sector that hunger was playing out in their offices, meaning that people would show up with, early onset of, type 2 diabetes or hypertension or even symptoms of heart disease. And the doctors or the providers would really kind of assume that there was plenty out there to help these folks and just say, well, you should probably just try to eat some more fresh fruits and vegetables. I'm sure there's a way for you to figure that out. When really the reason we had a White House Conference on Hunger this year, we haven't had one since the Nixon administration, is because it is truly still a patchwork. We have some very strong federal nutrition programs that support hunger, but they don't cover the whole diet. Then we have incredible work of our food banks, which McLane Hunger Solutions works with over 250 food banks providing food nationwide. But really, my passion is to help the healthcare sector and the hunger and human services sector come together, because only about 20% of a person's overall health is about access to healthcare. The other 80% is about lifestyle, where you live, your access to food, your access to housing. And our work between McLane Hunger Solutions and McLane Health Solutions is really an opportunity to do that. Because as Denton shared in his remarks, McLane Global is outstanding at the logistics, at the sourcing and logistics piece of food delivery. So we've really been able to, over the last few years in particular, to refine getting food, nutritious food, directly from our warehouse, which is behind Denton in Houston, or some of our other facilities across the country, from there, packaged with the support of a dietitian, right to the front door of somebody who may have otherwise really struggled with food access, because maybe they live in a food desert, maybe they have a disability, maybe you live in a cold climate or hot climate right now, where leaving your home is very, very difficult. And having that access to food, say you get that screen from your doctor saying your diet could improve your health. Well, we really need to do our part to figure out how we assist those individuals, because it's just not as simple as get more fruits and vegetables and just change your diet.
Thank you, Marissa, and I totally agree. And you tapped into something that I was able to speak on a few months ago. And you talked about 80% of people's health actually happens outside of healthcare or medical. It deals with having that access to foods, could be dealing with education. It's the environment that we live in. It could be the sex, the gender. There's so many different variables, and we talk about those social determinants of health and how they affect everybody's life. And sometimes when you're in the healthcare sector or you in the public health, you sometimes forget about, okay, let's look at this model and we say we're supposed to do it this way, but forgetting about the real life experiences of the people that we're supposed to serve, and understanding that not everybody might be able to get in a car and go grab these types of foods, or be able to have the education on what is healthy. So I'm so glad that you mentioned that. I'm so glad that you tapped onto that, and that just reassures the fact that you guys we are actually on the right path in reference to making sure that we're doing our research, we're making sure that we have the evidence behind the work that we're currently doing. So I just wanted to also ask, what are some of the current things that's being done by the health solution sector?
Well, we have a couple of very interesting projects we've done with different partners around the country. One TQ and I had the opportunity to work on, which we really enjoyed the process. And it was, I think, a really smart move on behalf of this provider network in Texas, just north of our warehouse in Houston, that they were screening patients that were primarily Medicaid patients in their practice, and seeing that leading up to school vacations was a very stressful time for the family. And the provider, especially when there was multiple children in the home, where kids would not have access to school meals during the school vacations, and also it was often around holiday time, so around like Thanksgiving time or the December holidays, and they thought, what could they do as a provider network to support those families? So what we did with the provider network was created a menu that was all healthy food. It was all no sodium, no salt, fruits and vegetables, whole grain pastas, whole grain rice. We've special formulated a pasta sauce with one of our providers that's actually for the food banks, because they requested it, that is very low sugar and no salt added. So we put those packages together. Thanks to the support of Dr. Davis and her incredible research skills, we put together an evidence-based survey after each shipment. So we were shipping home first about 100 boxes, but then it went up to about 500 boxes by the third shipment. And the results was really phenomenal. Not only did folks say they were consuming more fruits and vegetables during that time than they had before throughout the year, but the emotional response, I think, was what was most striking to us, was that they said they could not believe a provider would do that for them. And I thought that was really incredible. But they also said, they had tried new foods, that they experienced less food insecurity than they may have in the past from getting those shipments. So it's programs like that, and we didn't design it. We at Health on the Health Solutions side, Dr. Davis and I are here to provide support, because we do think the best ideas come from the community. So our role is to customize for you or our partners whatever they think is going to work best for the population they're serving.
Thanks, Marissa. And also, like as Marissa stated, her and I had the opportunity to partner and work along with this organization. And even from a researcher standpoint, as a researcher, you always want to make sure you have the data to validate the work that you're doing. And so, as Marissa stated, I was able to create some questions into surveys so that just to show and validate the work that we're doing is relevant, and it aligns with national statistics to the work that we're actually being able to accomplish. And so even from there, we were able to get some demographic backgrounds, and so we were able to see, what does that population look like? And so from there, if we happen to work with that population in the future, we think about, then that's when we look into health equity. When we think about being culturally aware, thinking about how can we make sure that we provide the right types of food for that specific population, and being sensitive to the culture. So as Marissa stated, it's very important that one, we have a collaborative effort to let them know, hey, we're here to support you, but also using research and using evidence and science to make sure that we validate the work that we're doing. Because I know a lot of the stuff that we put together, the boxes that we put together, were vetted by a dietitian. So we want to make sure that everything that we do checks all of the marks, to make sure that we're mindful and we're thinking about the safety of the consumers and the participants that are actually participating in the programs that we're serving. So thank you, Marissa, for sharing that project, because I personally enjoy doing that project. I mean, like I said, as a researcher, I enjoy looking at the data for us to be able to say, oh, this is great. We have this amount, that we have this population from this age group that have this amount of kids. So how can we move forward when we come to working with them in the near future? Thank you. So Denton, I have a question for you. So how can the food industry make an impact on the current issues healthcare providers are currently facing?
Well, there's a lot of ways that we can make an impact, and that, just looking at the Q&A a little bit, you're already seeing a couple of questions coming up about food quality and processed food and food health, and that's really a lot of it. Is there's a lot of different things going on in the food industry at the same time, because it's a capitalist market, and that's really what drives it. And then that's what I see a little bit of difficulty in finding the links that are developing between that and the healthcare industry, because healthcare it has a little bit different base. Pessimistically, yeah, it's still a capitalist market at the same time, but the goal of a more holistic goal of good outcomes for the participants and patients coming through is a lot different. So there's a lot different focuses, and in trying to align those, the difficulty is, how do you take a general public that's been marketed to and gotten accustomed to eating fast food and convenience store meals because it's quick, because I don't have time, or because that's what's the only thing that's available to me. And that, as we've seen, as time and technology has moved on, there's a lot more solutions than the come and get it type of grocery model that we've generally had, where I build a big store, you invest your time and your resources to come to it, fill up your basket, and then go back. Great grandfather McLane did it that way. But in the 21st century, we got cell phones, and we have internet, and we have all these remarkable tools that we can use. We have just-in-time inventory. We have order, and I order it at my home or at work, and it shows up by the time I get home. And so, what are some of these best practices and new ideas that are coming online, and how can we really bring that together? And then the second part of it is, I agree. Processed food in general as a bucket statement is a bad thing, and we need to avoid it. But when you get specific and you really look into it, the canning process is the most efficient packaging process that it is, other than maybe a little bit of salt. You heat treat the cans, and it stays at shelf stable temperature for years and not months. So that increases access. And if you look at it, the food market historically, 200 years ago, 85% of the population, based on today's standards, live below the poverty level. So we come and we built this great industry in food science that's really gained access for everybody. But then now, how can we take it to the next level and drill and reach some of the cracks that are reaching that have been underserved by that model? And another way that we've seen that that's possible is new packaging innovations, new delivery innovations, and that's what we really try to stay on top of, because we span the world. We can see all of the new trends that are coming online, and then really getting into how can we then start changing to what Marissa was saying earlier in other programs that we've run, where people have said, hey, now that I have fruits and vegetables in the house, I eat them more and I'm doing better. In that generally, food is medicine. It doesn't take a lot of common sense to realize, but we got the data to back it up. Once you start eating more healthy, you start living more healthy, and you're going to go to the doctor less, and your conditions are going to come down, and that holistically for the healthcare provider, then they can use food to drive better outcomes for themselves. And that's really what we want to try to work and build some relationships and create opportunities.
Thank you, Denton. I think that's awesome how you provided a little bit of education on the process of food and how it's shipped and how it's procured, because I think there's a misconception and a miseducation pertaining to shelf stable, even canned. And I think there needs to be a lot more education pertaining to not of this myth of can not being healthy. And so I think there needs to be a lot more education when it comes to that. And I appreciate you mentioning that because, I mean, me coming from a healthcare background, I didn't know that. But as I work alongside with McLane, I've learned so much in reference to how food is created, how it's procured, and just breaking those misconceptions and those myths that we think like, oh, it's you can keep it on the shelf, but
Yep.
oh, that's healthy. But if you think about it, everybody in their homes, I have rice in my
Yep.
shelf. I have
Yep.
noodles in my shelf, and I know that's going to. And you think about sustainability, because it helps to sustain. And I know Marissa mentioned earlier about maybe people not having access to grocery stores. So if they live in rural communities in cold weather, they might have to hike through snow. They're more than likely want to have canned goods, right? Or shelf stable products to make sure that they sustain having access to certain types of food. So thank you so much for
And
providing.
it accents the fresh component that you can. It's there's not one that's better or best. We live in a world where we need to use it all in what we can do to help survive and make ends meet.
Yes, thank you for saying that. And you as a business leader and a leader in the community, you understand the importance of investing in public health and healthcare.
Mhm.
So what type of advice or input that you can give to other business leaders to talk about the importance of investing in public health and also investing in healthcare?
Well, if you're speaking to business leaders, then you're going to hit them in their pocketbook is generally what you would say. But several years ago, I had the opportunity to hear Warren Buffett speak, and he was talking about just broad demographics of the United States. And if you read his investing philosophy, he's a big believer in the United States and the opportunities we have here. But he said one of the largest problems that we face is that when you just look at it at a mass national level, at the government level, we pay about 8 to 10% of our GDP goes to healthcare for one way or the other. And that if you compare us, it's smaller, but it's as technologically developed as compare us to the country of France. France pays between 5 and 6% of GDP. You have a longer lifespan in France. You have more hospitals, and so they pay less for a better system than we do. And so why is that? And what is that? And it's a lot of it is being addressed now with how can we bring things together and address people as individuals and not just as consumers. And so what I would say is driving down and creating healthy lifestyles and creating more public health options. You're going to start driving down the cost of healthcare. You're going to have people start living better lives. You're going to have employees that are in the office longer, that are more attentive and more engaged in what they're doing, and feel like that they're in a place that cares about them and values them as an individual. And so that's what I would say to business leaders, but it just makes just good common sense in that how can we do to help everybody live a better life? We have all this science. What can we really do to really change people's lives other than addict them on more social media or other distractions that we don't need? And that's what I hope we can be a part of, is creating more opportunities and more solutions that are out there given what we have.
Awesome. Thank you. I always tell Marissa, I was like, every time I have a meeting with Denton, I'm always like so impressed because it's amazing to
It goes
have
both ways.
it's amazing to have leadership that understands that it's not always about, the dollar, but it's also about the people that we serve. And every time that we have a meeting with it, he's always reassuring the fact that, you know what, we're doing the right thing.
Mhm.
We're doing the right thing. And I always am
ma'am.
impressed. So with Denton and his leadership with this organization. Thank you, Denton, so
Thank you for
much.
saying that. You flatter me.
It's the truth. I tell
I'm
Marissa all
blushing.
the time. So, Marissa, I have one more question for you. And I know you came from more of a social services and a public health and healthcare background, just like myself, and now into the food distribution company. And this is a different type of work. So why do you feel it's important that this organization like a food distribution is part of these discussions?
Yeah, well, one of the things I reflect on frequently, both with Denton and our CEO, Todd Priest, is when I worked in the hunger field, I worked in the healthcare field, and I really did not know a lot about what it truly takes to get food to people. And that's what has been so great to see, working within this company, learning the logistics business, but actually understanding, geez, what does it really take to be able to get food, from a warehouse in Houston to the Northeast, we get boxes to Alaska all summer long for one of our hunger programs. And really understanding that piece of it helps put more puzzle pieces together. Because I think if our healthcare and our human services sector are working kind of in their own silo without the food industry really behind them with that logistics knowledge and procurement knowledge, we don't have the whole picture. And that's what I think has been really great in this work, is that we're really trying to bring the whole picture together. I know we have a number of our food bank partners on the call, some of our healthcare partners on the call, and it's exciting that we're able to kind of all be at the table together when we do this work. So one other thing I would say too, because I'm reading some of the questions, which we so appreciate them. Thank you everyone for submitting your questions, because I think everybody often, given that we provide primarily pantry items. And as TQ said, the pantry to me is a real cornerstone of my house. I'm always look at my pantry first and then look at what's in my fridge to add to it. But we've had many, many discussions about how important also pairing those shelf-stable pantry items are with fresh. Now, people have oftentimes have less access to fresh. Also, if you're changing your diet, it can be very nerve-wracking. Even if you go to a food pantry and get a big bushel of spinach, what do I do with it? And I only have a very short time to eat it. What we are working on with our program going forward is helping folks understand access to fresh locally, and even hopefully providing some access. There's a great program through Kroger where we could offer, produce cards. We really believe in SNAP and SNAP outreach so that people, if they're not accessing SNAP but could be able to get that. And then our program is a really great additional benefit where you could, we're trying to really provide everything we can in that accessible way, in that shelf-stable way, but also be able to say, how does this round out your whole diet? So I think even just being able to think about that, thinking about the whole picture of food logistics, given the experience of McLane Global and the McLane's family's incredible history in food, but then also understanding everything we've learned from our partners over time.
Well said, Marissa. Thank you so much. So I'm just going to throw out one question for both of you guys, and then we're going to go to our Q&A. So we want to make sure that we honor and read those questions that were put out by our audience. So Denton and Marissa, what is next for McLane Health Solutions?
I'll let Marissa go first. Ladies first.
This is a test. I think what we would really like to do. So first of all, as I said, many of our food bank partners are on the call, and they have done and are doing extraordinary work in the food as medicine space. We've seen medically tailored pantries. We've seen mobile pantries that focus primarily on chronic illness. I mean, just incredible work. We would love to continue our work with the food banks if there's anything more we can do to enhance our business, both on the hunger and healthcare side. But I would love to continue the work to develop our partnerships. We have, like I mentioned, the great work we did with a partner in Texas. We have other partners nationally. I would really like to see our business and other businesses like ours, honestly, with our experience in food logistics, stepping in as somebody at the table with human services, healthcare, and the food industry to really start chipping away project by project to the problem we have of chronic disease in this country that is often fueled by food quality and what people are eating. So the more we can help other partners, I really hope we can just get at more tables and have more partnerships and continue that growth in the future.
What I would say add to that is that, time goes by and we as a business are growing and developing and creating new opportunities for what we do. So, where we come from and what's been frankly easiest to get started with is canned product in that product. But as time goes by and partnerships and new opportunities are created, we want to start creating and blending into that fresh and processed type of product. We see frankly, right now, the biggest inhibitor for that is cost. We could do it right now, but it's unaffordable given the modern logistics systems to get that to it last mile done to get it to people's door. And that's really the trick. And there's a lot of varieties. Marissa mentioned Kroger is now going to a massive online format to even in areas where they don't have brick and mortar stores, they're going to offer online delivery. So how can we partner with that? And as more opportunity comes by, what can we do to bring people together that, hey, we work in this sector together and doing this, but we can create some good in this sector and create access and opportunity. So how can we continue to grow and create options for people and more options as time goes by?
Awesome. Thank you both. All right. So we have a few questions in our chat box. So I'm just going to read a handful of these and I'll just open up the floor for you guys to answer the question. So our first question is, what are the program/steps that you guys are taking to convince people that food is medicine when majority of the food is processed? When good is mostly tailored for shelf life? So I think the question is, what current programs are we currently doing to convince people that food is medicine when a lot of the food that's out there that's convenient is processed?
I think we've addressed a little about that in the time, and it's just, hey, this is where we're at and what we're getting started at. And it's like in any good partnership, a lot of partnership, half of it is listening. And so we've kind of come to the market and said, hey, we're a food sourcing and industry people. How can we, we want to be involved. We want to be engaged. We see a need here. This is our idea, and then now we're getting out and we've taken some initial steps. We're getting some feedback in that what can we do to create and solve specific problems that either healthcare providers, health industry people are facing. And we're taking a lot of that coming back and then saying, how can we partner and combine our perspectives to really gain access and gain what the most effective program is. And there's a lot of different areas that where we worked in where, hey, this is a solution, as Marissa mentioned, for school children in Alaska. And so we have to solve specific needs for them because we can't send peanut butter and the normal type of stuff because they live on native reservations in Alaska. They're used to eating salmon and caribou and things like that. So we need to get food that speaks to them and their individual situation. And we've been able to do that in a lot of situations. So that would be what I would say. And Marissa can get in a little bit more into some other specific programs that we've been involved with on that.
I mean, I think Denton said it very well. And I hear what the person asking the question is saying about processed food because it's just such a big range. There is truly unhealthy processed food out there. That doesn't necessarily mean a whole wheat pasta or spaghetti in your cupboard is not good for you. So what we really try to do is separate the good from the bad when it comes to the healthcare piece. We work very closely with a contract dietitian that evaluates the health of every item we have or the nutritional benefits of every item we have and chooses those specifically of like, this is what is in and this is what is out. Because the pantry really is, and I agree, we've said this many times, the pantry is really the cornerstone of a person's diet. It's where if you're going to make a veggie-rich bowl, to me, it usually starts with a nice base of brown rice or quinoa or something that is in your pantry that you can count on as that base. And then from there, you build it out with other items. And that's really what we're looking to do is there are foods that are in your pantry that are healthy, and you can really rely on them from a food security standpoint, to be honest, that they are there. They have good nutritional benefits, and usually they're inexpensive too, so that when you can use those foods as the base of your meal, it's the starting point of good health.
And I agree, just to piggyback on, you guys both said it so nicely. And I think education is extremely important. Making sure people are educated in reference to what is healthy, what's not healthy, and the misconceptions of what some people might think is not healthy. So Because of my health education background, I'm big on making sure that you know and don't just assume, but just having that education, because education can help you make those better choices. Another question is from Justin. How do you see agriculture changing if there is a shift away from unhealthy processed foods that use a lot of corn and soy? How can regenerative practices be incentivized and scaled to support this shift?
Well, Justin, I agree with you. I think you're seeing a change away from a lot of these practices, and a lot of that is starting to come from just I'd say a basic education, but then B. My dad jokes that the food business is a soulless business, and they'll kick each other in the teeth for 0.25%. And so this is capitalism at its best. And how do you combat that? You get people who demand different products and demand better products. And you're starting to see that. One of the largest organizations in the world is the Coca-Cola Corporation, and they've made a decade or centuries of selling sugar water that people really don't need because it doesn't really solve any basic need. But at the same time, what are you seeing them do now? They're investing heavily in fruit juices, in more healthy water offerings, things like that, because they know that canned soda is the thing of the past in this next generation. I have an 18-year-old that doesn't even drink soda. I'm still drinking mine on this, but you're starting to see that. You're starting to also see, like, I think Annie's Organic, the brand, has been bought and sold 2 or 3 times, and it keeps growing in value because these large entities, they don't know how to create that healthy or healthier type of offering, and they're having to go out on the open market and buy it because they know the consumer demands it and is going to demand it even more. So what I would say is an army of one, Justin. I would start supporting the brands that you think are making healthy choices, and then that makes it to our level. And that's what we try to find is generally a lot of the brands and new innovative products are a new package or a new formulation or something that takes out high fructose corn syrup and all this hydrogenated oils and all the stuff that we really don't need, and that are replacing it with more sustainable and things like that. So I see it coming. I think we just need to be patient and watch it develop.
Awesome. Thank you. That was a good question, Justin. Thank you, Denton, for answering that. So we have a question from Chris. He states, my son and I, 4th generation, work with McLane. Our factory started with candy production in 2001. We recently launched Yuva Organic in Dubai 2019. How do we expand our knowledge of McLane Global overseas? Oh, and then he left his contact information. That might be a sidebar
Chris, I
conversation.
got you. We can help you a lot. We work. Actually, we have a sales office in Dubai, sell throughout the GCC. Work Pan Asia, from South Korea in the north to Malaysia, all the way in the south, and everybody in the middle. So a lot of opportunities, and I will take your contact information and introduce you to Prashant Iyer, who runs our international division.
Awesome. Thank you. You guys, we have a lot of questions. So I'm going to jump to a question from Melissa Linder. How can you partner with public entities to address food insecurity in rural areas?
I am happy to take that one. Melissa, I'm not sure where you live, but I live just outside of Burlington, Vermont. It might be a little noisy here because you can hear my 4 acres being plowed. I live on what was formerly a dirt road, so I very much identify with this question and care a lot about getting food to folks in rural communities. Some of the work that we've done around the food delivery model has been really great for rural communities. As Denton and I think have just touched on a little bit, we've worked on a USDA demonstration project for the last few years where we've gotten food to homes of kids who in the summer don't have a summer program, and it's very hard. It's hard for them to get to because they're living in remote areas. For the food as medicine work, I really see that as often a challenge, especially for folks who are aging, and may have ability issues or issues driving or live in a food desert. And now we have the issue of inflation. So we had a very expensive summer when it came to gas prices. People were sort of trying to consolidate their trips to the grocery store, stretch their budgets longer. But what we can really count on in this country, which is amazing, is our rural delivery through our U.S. Postal Service and our rural delivery through UPS, which has expanded, honestly, thanks to so many online retailers. So what we've learned to do over time, especially through the summer program, is how to pack food carefully, really make sure it arrives in great shape and to the front door with tracking information for those rural communities. I think there's so much more we need to do for rural America when it comes to food access. It was very much a topic of conversation at the White House yesterday. But I do think food delivery is going to be the wave of the future. We even see, SNAP benefits that you can use them on different services like Amazon and perhaps Kroger who do food delivery. But I think that's going to be very important for rural communities.
Awesome. Thank you, Marissa. We'll take about 2 or 3 more questions. So we have a question from Marcus Davis. How can we change the narrative to let people know that food is medicine? Is there any research to convince people that know that how important food is in what you eat? I mean, Marissa, I can assist you with this question if you would like me to. I can. But for
You know more than
question,
food research than all of us combined.
I know.
All yours.
Absolutely, TQ.
Yes.
So that's a really good question, but there's been so much research that has focused on food as medicine programs and studies. And there's been a lot of outcomes from peer-reviewed research from 2013 to the present. So I'm just going to give you some overarching outcomes. So there was a 16% decrease in net healthcare costs. With all these research studies, there's been 70% reduction in ED visits. There's 50% reduction in hospitalizations. And so there's research that just shows that there's been an increase in medication adherence. And there's more research that just shows that there needs to be more research showing the importance of medically tailored meals. And also additional studies show that patients with type 2 diabetes receiving diabetic medically tailored meals reduce blood glucose levels in 12 months. Another research study showed that older adults with cardiovascular disease receiving the DASH diet that we mentioned earlier, medically tailored meals, increased compliance with dietary recommendations. And among the elevated A1C participants at baseline, the A1C improved from 9.52 to 9.04. So there's scientific research out there that shows like the physiological improvements, also the medication adherence improvements. So there's a lot of data that supports the need for more medically tailored meals. There are a lot of data that supports the reasons why we do what we do. So if you need to get some links for research and studies, I can send that to you guys. But there's a lot of research that supports that. All right, so I have one more question. Has there been any data on the effectiveness of your home delivery model versus those where families have to travel with their prescription and select the various prescribed foods? That's a good, Chris. That's from Brandon.
I think that's a great question, Brandon. And TQ, this is good for you and I to think about going forward. And we appreciate that question because I don't think we have any comparative data. I think there is, though, a wide net of programs that work well. I will say, though, the data that we have from the program we worked on in Texas, where we got very comprehensive, thanks to our incredible partner and the wonderful work TQ did putting together a validated survey, we did see real results in improving health and food security during those time periods when we shipped home, when the kids were home from school vacation. like I said, we did not do a comparative study, but I'm curious about that. Would we ever do a study where we looked at home delivered versus the prescription food? And I do think that there are many, many programs that work, and we are one model that I think can even work well in concert. If you were going to the grocery store to buy, prescribed fruits and vegetables, terrific. You can come home to, I always say, I wish I was better about cooking dry beans, and I'm just not. I buy no salt added canned beans and make really healthy meals with them, with fresh vegetables and with, whole wheat rice or pasta or whatever might be in my pantry. And I think a lot of these programs need to work in concert together to create a whole healthy diet for people who have access issues.
Awesome. Thank you, Marissa. And the last question, we're going to bring it to a close, is from Marcus Davis. Which do you think is better, fresh foods or canned foods? I think we somewhat touched on this already.
I would just say that it's just everybody's situation is unique and what you're facing and what your needs are. And hey, fresh is always going to probably be better for you, but there's also times and spaces where, hey, I'm traveling and I'm in the car and I need to grab something quick and move. That's modern life. And so it's I would say either is great when you accompany it with daily exercise. How's that?
I think that's a great answer. And I just wanted to say, it's all about lifestyle, really. I've mentioned I live in the Northeast. It gets really, really cold. And the fresh local vegetables you get in the middle of winter here is so much squash, because it's the thing that keeps the most. And you get so sick of squash come February 1st that, yeah, I love frozen. I love canned things because I can make healthy meals. And then sometimes you just need variety. And if you don't live in an area where you can access a lot of, fresh local food, there can be great options there.
I agree. Thank you, guys. And thank you for those wonderful questions out there in the audience. I want to make sure that I answered all the questions. I asked all the questions that were relevant. I think all questions are relevant, but just want to make sure I covered all the questions.
Oh, Marcus's question about truck drivers.
Yeah.
Marcus, if we can solve something that makes truck drivers do something they don't really want to do, then, oh man, we can move mountains at that point in time. But no, hey, it's all about education is what I would say to that. And with truck drivers, it takes more than saying it more than one time. So being patient and showing that there's good opportunity even could turn a truck driver's heart. So
and TQ and I have some good ideas about that. We're playing around with our pantry kits to do jarred meals, overnight oats, great option that you can do in a jar overnight, grab it in the morning. I bet you could eat that in the truck, no problem.
Yes, it's all about education and being creative, right? All right, thank you guys for everybody participating. Just want to say, is there any closing comments that you guys would like to state? We are 4 minutes until the hour, and want to make sure that we honor everybody's time, but I also wanted to give you the opportunity to have any closing comments, any last statements of words of wisdom to our audience.
I'll just close by saying thank you to everyone who joined us. If you would like to just learn more about the work of McLane Health Solutions, we will be following up with the recording of this webinar on our YouTube page, and we'll send out a link to everyone after if you'd like to share it. We're more than happy to have individual Zoom meetings with folks. And the only other thing I wrote down to say, which I didn't say, so I'm just going to close with it, is one of the things that came up a lot at I feel like on the White House conference was that sometimes it's also not all about food. It's about hygiene items. It's about access to things like diapers or, appropriate cleaning products, that kind of thing. We really can solve all kinds of problems given the power of McLane Global and the logistics business. So I hope everyone will think creatively. If you think there's anything we can help with, I hope you'll let us know, because healthcare, as we said, is not only about food. It's not only about your access to the doctor's office. It's about the whole person. So if there's anything we can do to help with that, with those solutions going forward, we hope you'll reach out.
And I would say, what I would say in closing is just that this was, as I said, the beginning of a partnership and an introduction of McLane Global and McLane Health Solutions and what we can do. In any part of that, we'd like to hear back and like to hear back from you guys on what are you seeing and what ways that we can be involved and help you guys. McLane healthsolutions.com, McLaneglobal.com. You can find us on LinkedIn. Through both of those websites, you can find all of our email addresses to contact us. So would love to continue to interact and hear your stories, where you see that we might be able to be of some benefit, and let's start that conversation and keep it going. And then as TQ said at the top, hey, this is the first of three. So if you weren't completely bored, then come back for the next one and enjoy it. And Marissa, I guarantee you, is much more entertaining, in fact, in TQ than I. So I'll be much more of them and much less of me. So looking forward to continuing this conversation.
Awesome. Thank you so much, Marissa and Denton, for your time, your experience, your expertise, your passion. And I get to work with these two wonderful people quite often. So I'm honored to be part of this team. And
We're
you guys
lucky
bring
as well. TQ, you're an awesome lady. We love having you on
Oh,
the team.
thank you. You guys are a wealth of knowledge, and I'm excited to see where McLane Health Solution goes in the near future. And as Denton and Marissa mentioned, thank you so much. Follow us on LinkedIn. The recording is going to be on our website, www.mclanehealthsolutions.com. And our next webinar is scheduled for Thursday, October 27th. And we'll be speaking with leadership from various food banks. So we're going to focus on food banks across the country. So that's going to be a real good conversation, because Marissa works a lot closely with the food banks. And also you'll be getting a survey to make sure you give us some feedback on how we did. What would you like to see? What would you like to talk about? And we're so excited of the future of our organization. We're so excited about the partnership that we're going to have with you guys, and just continue to reach out to us. And we pray that you have a wonderful day. You guys take care. Bye.
Thank you, everybody. Have a great day.
Thanks, everyone.
Bye-bye.